Hi, my name is Chris McCreary. I'll be talking about Guillain-Barre syndrome today. Guillain-Barre will also be referred to as GBS throughout this presentation. So first I'll give a brief overview about the actual syndrome and treatments utilized for GBS, but the majority of this presentation will be a review of the research article titled The Influence of Exercise on Patients with Guillain-Barre Syndrome. So first, what is GBS? GBS is an acute inflammatory post-infectious autoimmune disorder that causes demyelination of the peripheral and autonomic nerves. There is no known cause of GBS, but it seems to occur in people who had just gotten over a bacterial or viral infection or some type of traumatic event for their immune system. For example, a coworker of mine was diagnosed with GBS 2 weeks postpartum. So GBS is not inherited or contagious, and it can cause muscle weakness and altered sensation, resulting in decreased balance capabilities, poor postural control, decreased joint mobility, and antalgic gait. So some treatment options for GBS patients include immunotherapy such as plasmapheresis. Since GBS is an autoimmune disorder, it is thought to be caused by factors such as antibodies. Plasmapheresis is a plasma exchange that removes antibodies from the bloodstream. Steroids is another option for GBS patients, specifically corticosteroids, which are given to reduce inflammation and reduce nerve damage. Effects from GBS can be severe enough where supportive care such as ventilators may be necessary. Damage to the phrenic nerve that innervates the diaphragm can significantly impair breathing. About 25% of people affected, this disease can lead to a need for artificial ventilation. Physical therapy is also needed to restore mobility, restore strength, and provide neuromuscular re-education. Let's take a look at the research article titled The Influence of Exercise on Patients with GBS. This article is a systematic review that included a total of 7 studies that examine the effects of exercise intervention on patients diagnosed with GBS. So we know that exercise is already prescribed to GBS patients to improve their health outcomes. The purpose of the review aimed to examine recent research on the effects of exercise on patients with GBS and provide evidence for the most effective type of exercise. In the single subject design that consisted of 20 patients, they used 12 weeks of bicycle training that resulted in increased oxygen uptake, increased power, and increased muscular fitness. The randomized controlled trial included 79 patients. This study examined high-intensity exercise versus low-intensity exercise. Higher intensity resulted in significantly greater improvements. In case report 1, one patient was studied performing on a podiatron. A podiatron is essentially a machine-powered wobble board. This patient saw improved walking confidence, increased foot surface area, which increased their base of support and improved their functional mobility. The patient in the second case report participated in a 10-week walking program, followed by a 15-week cycling program. Upon completion, increased endurance and pulmonary function were reported. The third case report showed increased muscular strength as a result of 1 hour of functional exercise per day. And the last case report resulted in improved aerobic fitness with a 20-minute cycling program at about 75 to 80% maximum heart rate, performed 2 to 3 times per week for 16 weeks. The quasi-experimental study included 20 patients who performed 12 weeks of bicycle training. These patients reported increased maximum heart rate and increased isokinetic muscular strength, specifically in the elbow flexors, elbow extensors, and knee extensors. So to summarize the results, GBS patients experience improved physical outcomes and improved mental functioning with numerous types of exercise. Based on this review, cycling appeared to be the most effective type of exercise, but more research is needed to increase the validity of these findings. A few things to consider with regards to gaps in this review. There was a lack of representativeness, particularly in the case reports. There was only one patient involved in each of the reports, so it's a very small sample size to base results. There was also a lack of exercise parameters, or exercise intensities, for studies that include walking or cycling programs. The majority of the studies also had no standardized baseline assessment of the severity of GBS in each patient, which makes the effectiveness of the treatments difficult to compare. Questions such as how to quantify or assess GBS severity and what optimal modalities should be utilized for those different levels of severity still need to be addressed. For those of you who would like to read the full contents of the article, here is my reference for the influence of exercise on patients with Guillain-Barre syndrome. Thank you for watching.